Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. And he was saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out it again and checked it again. He sat down and said, "It's gone." Hi, my name is Nesta Vicencio and I'm 32 years old. I'm an insurance agent, so I'm in sales, so you could think of I've been talking a lot, and I regularly sing because of ministry. So I sing on Sundays, so I use my voice a lot. Starting January 27, I started losing my voice, and then the hoarseness remained for more than 2 weeks. And this started bothering me, like what's going on with my voice? It's taking too much time. 2 weeks and a few days, I decided to see my ENT doctor, and he diagnosed me with chronic laryngitis. And then, for the first meeting, he asked me to take steroids. The point is to remove inflammation. So he's saying that probably I have throat inflammation because of voice use. So fast forward to taking the steroids for a week. I've been on voice rest, and whenever I test my voice, the hoarseness is not going away. I'm still strained. Whenever I try to talk, it gives me pain on my neck up to my head because it feels like I'm using head tone every time I try to produce sound. So I went to a different hospital, and a different doctor did the video stroboscopy to see what's going on with my voice box, my vocal cords. And when he did that, I already felt nervous about what I'm seeing on screen. And then when he started saying that you have a vocal cyst and the only way for this is to undergo surgery, tears started falling down my face and I just couldn't help it. As someone who uses my voice every day in everything that I do, in my work, in my ministry, talking, singing, it's like too much for me to take. I asked for the recovery and the doctor said, for now, you need to go on voice rest to remove the inflammation. Take the steroids to remove the inflammation. Once you're cleared, then you can go for surgery. And that's the only way. I said, so if I will have vocal surgery, will it affect my voice? Then they said, you will be able to speak again. But as for your singing voice, we have no assurance for what will come out. Honestly, after the 5 doctors, it felt like, okay, there's no other way but surgery. And then one day, our good friends, Sister Jazz and Pastor Shyan, they introduced me to PPAR's extract. This product helps with cysts, tumors, and it helps, and it's all natural. So for me, what would I lose by taking something natural and non-invasive and something that's recommended by people I trust, people I love? So I said yes to them because I'm at the state where I really want another option other than surgery. So at first, they recommended me to take the PPAR's extract liquid, which is a liquid form of PPAR's, and they asked me to take it for 3 days. Then after that, they gave me PPAR's extract powder. And then after 2 days or after 2 vials of PPAR's extract liquid, there was a morning that I forgot that I'm on voice rest because I just woke up. So I just woke up and greeted my husband, and my husband was like, "Why are you talking? You're supposed to be on voice rest." And we were both like shocked that, "Oh, I'm not supposed to talk." And then he said after, "But baby, your voice sounds better. It sounds normal." So I tested my voice again and said another line. And we looked at each other and said, "It sounds normal." And this time, it's just on my second vial. After 5 days, so 3 days vial for the first 3 days, and then on the 5th day, on the 4th and 5th, I'm already taking the powder of PPAR extract powder. So I got so excited and curious, so I went to see my doctor. I will never forget this moment because when I entered the room, my doctor said, "So what's your plan with your life? When are you going to do your surgery?" And I was like, "Oh, doc, I'm done with taking the steroids. I'm done with my voice rest. I've been on voice rest, strictly doing it." And then when I was talking, my doctor said, "Is that your normal voice?" And then I told him, "Yeah, it is my normal voice. Does it mean I'm okay?" And then he said, "Well, of course, probably because of the steroids," which I didn't tell him. Before taking PPARs, I decided to throw away my remaining steroids tablets because I've read about it. It's not really good. So on my own, I decided to throw it away and start taking PPARs. And then he said, "Oh, probably it's just the steroids because the inflammation is gone. That's why you're back on your normal voice." I said, "No, the cyst will not go away on its own. So it's probably the voice rest. So come, let us check it." So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. Then he was saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out it again and checked it again. And then that's through the mouth. And then he said, wait, one more time. I'll just try it through the nose." So the doctor who was supposed to finish our appointment said, "Oh, one last time. I just want to see it one last time." So he tried it through the nose and checked through the nose. He said, "It's really gone. Oh, can you tell me everything that you did? I need to document this. Is it okay if I write a report about your condition? Because the cyst is gone." And then he said, "Oh, maybe I will see you in 2 months. Just come for a checkup. Let's see what will happen. But you can continue with voice rest. Don't get too excited." So I'm really, really grateful that I got introduced to PPAR's extract, the liquid and the powder.
So Simply Nature PPARs actually have very strong anti-inflammatory properties and anti-inflammatory nutrients. So with Nesta's case, being her voice box is inflamed, no? Which eventually led to her vocal cords developing cysts. With less inflammation inside Nesta's voice box, it eventually led to the resolution of her vocal cord cyst.
When you get diagnosed with this, and the doctor would say that the only option is surgery, of course, it's good to listen to your doctor, but it will not harm you to try PPAR's liquid extract and even the PPAR's extract powder so that you can get better.
Where will you go? My heart is open wide.
Pwede daw dun sa mga life stage na pagdadaanan ng mga tao. Merong iba't ibang priorities. So we have protection.
My name is Nesta Vicencio, and I trust Simply Nature.
Hello and good evening, everyone. I'm Sheila, your host for tonight. You are watching another episode of Simply Nature webinar, your long-time running healthcare awareness webinar here in social media. This program is co-hosted by Simply Nature International and SMG, or Simply Healed Medical Group. Tonight's topic is entitled Breast Cancer and High Cholesterol, 5 Wrong Ways to Manage Cholesterol Levels for Breast Cancer Patients. These two conditions not only impact individuals, but also present significant challenges in all the people involved in the health journey, most especially if one patient has both. Understanding the complexities of breast cancer and high cholesterol is essential for promoting early detections, effective prevention strategies, and also improve patient outcomes. We would also love to know where you are watching us from. So please comment down if you are watching us from Luzon, Visayas, or Mindanao regions, or how about outside the Philippines? All right, please comment down if you're watching us from Malaysia, Singapore, Middle Eastern countries, and also the US. We thank you all for watching us tonight and joining us tonight. Our hope is to equip you with knowledge to better take care of yourself or your patients in this health journeys. So just before I introduce our next speaker or our speaker for tonight, please know that tonight we will also be having the AMA or Ask Me Anything portion. So yes, questions are very, very much welcome. So just drop them on the comment section. Now to start off our discussion for tonight's topic with his case presentation, let me introduce our speaker. He is a graduate from St. Luke's Medical Center, College of Medicine in 2016. He is also a diplomate of Medical Society's International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, the president of SMG, or Simply Healed Medical Group, Dr. Jansen Calalan. Good evening, Doc.
Hi everyone, this is Dr. Jansen Calalan, your lifestyle medicine doctor and the president of Simply Healed Medical Group, here to present to you another case presentation of another patient of mine. Now, today we're going to discuss high blood cholesterol levels in breast cancer patients and what not to do, no? And how significant is it for us to lower our blood cholesterol level, no, in preventing cancer recurrence. So, usually, blood cholesterol level is associated with heart disease, but it also has a big influence in preventing recurrence. Now, let's take a look at what happened to my patient. So this patient of mine is a 48-year-old female, known case of breast cancer stage 2A, already underwent mastectomy on her right breast last 2019. Now, she came to me because of her high blood cholesterol levels. So, on May 2022, this is her blood chemistry levels, no? So, take a look at the total cholesterol, which is at 228. LDL, which is the bad cholesterol, no? This is the main type of cholesterol that deposits cholesterol in your arteries. So, it's at 144. However, fortunately, her triglyceride levels is at 52.9. Now, upon investigating her diet, the patient reported to have been eating plenty of eggs and oily foods the past few days. Now, after talking to the patient, I prescribed her immediately with PPARS Plus tablets, Cleansing Plus, and a repeat lipid profile after 3 months because apparently the patient just wants to go all natural. She doesn't want to take any medications. So, this is what I prescribed her. Actually, microalgae, like Simply Nature's PPAR Plus tablets, can lower cholesterol levels. However, that will only happen if you actually control or you don't eat too much cholesterol or foods that is high in cholesterol. Cleansing Plus can also help lower cholesterol levels. How? The Cleansing Plus is a fiber supplement. So, how does this lower cholesterol level? No? So, this is what happens. When we eat foods that are high in cholesterol or fatty foods, our blood cholesterol increases. Now, when our blood cholesterol increases, this goes to our liver, and our liver metabolizes this into bile acids. So your bile acids will now go to your intestine to bind to fiber, to be eliminated in your stool. So actually, in concept, how do we eliminate excess cholesterol inside our body? It's through our stool. Since the patient is very fond of eating animal food products, high fat meals, no, very low. Her diet is actually very low in plant foods. I immediately recommended Cleansing Plus for her because we need to lower down her cholesterol levels. Well, naturally, because of her hard-headedness. Okay. On September 2022, this is just 4 months later. She came back, and her cholesterol level was higher more than ever. It's now at 251. LDL cholesterol was maintained at 143. Triglyceride levels are still the same. SGPT is now at high normal levels at 43. So what happened? This is what happened, okay? The patient was not able to lower down or cut her intake of meat products, okay? Meat products is where we find cholesterol. Okay? And cholesterol or dietary cholesterol is unique to animal food products. Okay? So I told her, okay, you know the answer to your dilemma. Okay? You need to lower down your cholesterol level because if not, you'll either suffer from a heart attack or your cancer will recur. So she said yes, and I continued to prescribe her with PPAR Plus tablets. I asked her, do you want to take medication already for this? She said no, because she was really adamant. If I have prescribed her with medication, cholesterol-lowering medication, it would have been useless. She wouldn't have bought it and took it. So I just made an informed patient decision with her. On her next follow-up, on February 2023, this is what happened to her blood cholesterol level. It did not change at all, okay? Her cholesterol level is still at 250. And her LDL cholesterol is at 155. So this is higher than ever. So I was asking her, what happened? Why is your cholesterol still this way? So I immediately did a food frequency questionnaire. I looked at the different food items that she ate in a span of 1 week. And this is what she ate, no? For 1 week. She did not eat beef at all, which is good. She ate trace amounts of pork, no, just a little bit. Perhaps this is just minced meat. Perhaps she ate chicken only 1 day in those 7 days. However, she ate eggs 2 to 3 times in a week. Most days of the week, she was eating fish, seafood, and her cooking method centered around the use of corn oil. So she was eating fried foods most days of the week. She was also eating nuts. However, it was just 1 day in that particular week. So if you take a look at her in the food that she ate, no wonder she was not able to lower down her cholesterol level because she's still eating foods that are very high in cholesterol. The most notorious one here would be eggs, followed by seafood like fish, shrimps, no, crabs, squids. So upon seeing this, I immediately recommended her for her to eliminate seafoods, eggs, and her 3-in-1 coffee from her diet. So I forgot to mention this, but she loves drinking instant coffee. Now, instant coffee, why is this so dangerous? Because the non-dairy creamer that they use is very high in fats. Okay, and this is also very high in sugar. If you have excess sugar in your diet, the sugar turns to fat. When that turns to fat, then your liver will produce more cholesterol to transport the fats that's inside your body. Furthermore, I also recommended for her to change her use of corn oil. Now I asked her, okay, can you do or can you cook or prepare your foods without using oil? She said no. Okay, so I have to find her a substitute for corn oil, which is olive oil. Okay, so I asked her, okay, you cannot fry foods with olive oil, and olive oil is very expensive. So I'll allow you to use olive oil so that you can still have that texture. However, since this is very expensive, you'll only use little amounts. And this one would be to her advantage because immediately we would be able to cut down her oil consumption. Next is to change the 3-in-1 or the instant coffee. Okay? So instead of drinking instant coffee, I advised her to drink green tea instead. and to engage in 30 minutes of moderate intensity exercise once a day, because exercise can increase your HDL cholesterol, which is the good cholesterol that we want, because HDL harvests excess cholesterol from the from your arteries. This is what I recommended her to do. Now, why is cholesterol lowering very important in breast cancer patients or patients who have been diagnosed with breast cancer? It is because, take a look at this study. The cholesterol metabolite, okay, 27-hydroxycholesterol, induces the proliferation of hormone receptor sensitive breast cancer cells and facilitates metastasis. Okay, so in short, if you have high cholesterol levels, your chances of recurrence and getting stage 4 breast cancer upon recurrence is very high. Okay? If you have high cholesterol levels. Now, let's take a look whether or not this phenomenon really happens. Okay? So this is a study actually done in Singapore. Now, this study observed breast cancer patients who have low cholesterol level because of the use of statins. If we increase your cholesterol levels, you increase your chances of recurrence. Likewise, if we lower your cholesterol levels, your chances of recurrence will also lower. Now, where can we find people who have low cholesterol levels? Of course, it's people who are using statins, okay, or cholesterol lowering medication. And this is what they did in this study from Singapore. So in this study, they found out that estrogen receptor positive and HER2 receptor negative breast cancer patients had a lower risk of recurrence when they use statins. Now, indeed, this is the evidence that the level of cholesterol inside our body has a big influence on our rates of recurrence. Aside from statins, do we have other products that can help us lower our cholesterol levels? Yes. So just like here in this study, these researchers studied the regulation of cholesterol metabolism by phytochemicals derived from algae and mushrooms. And in this specific study, microalgal astaxanthin was specified to be able to suppress cholesterol and triglyceride synthesis inside the liver. Furthermore, microalgal fucoxanthin is another nutrient or phytochemical that influences the enzymes that control cholesterol levels and effectively lowers triglyceride levels in the liver. This is actually one way on how microalgae like Simply Nature PPARs plus tablets can lower cholesterol levels. However, here's the thing. If you still continue eating high cholesterol foods, even if you take microalgae, your cholesterol will still go up. It will be very difficult for your body to counteract the risk. So it's very important to still implement the appropriate lifestyle changes in order for you to reverse the recurrence rate of breast cancer. Now, this ends our webinar. If you have questions, we're now open to answer them.
So much in the discussion made by Doc Jansen Kalalam. So without further ado, we are now in the Q&A portion. I'd like to call on once again. Can you hear me? Can everybody hear me? Okay. Okay, one more time. Welcome once again to our webinar, Simply Nature webinar. By the way, this is our 117th episode. Okay, so thank you so much to you all for always watching us. We are now in the Q&A or AMA portion. So yes, questions are still welcome. I can see that questions are coming in. So without further ado, I'd like to call on the person who will answer our questions for tonight, the president of SMG, our Simply Health Medical Group, Dr. Jansen Kalalam. Good evening, Dr. Jansen. Kamusta po?
Hi Sheila, hello everybody who's watching. Good evening. Happy to be here. I hope you learned a lot sa naging case presentation natin a while ago.
Thank you, Doc. Thank you so much for that discussion. So once again, guys, you can comment down your questions and also where you are watching us from. So let's start, Doc, for our first question. All right, this question, Doc, was thrown to us privately by Miss Felicity Santos. Is it true that medications for cancer can affect bones? According to my bone densitometry, I have osteoporosis. Done my first dose of Solendronic.
Yeah, actually, yes, no. There are certain medications for breast cancer, especially hormone therapy. Okay, so that would include your tamoxifen, anastrozole, letrozole. Okay, that can cause osteoporosis. Okay, so the role of zoledronic acid is to prevent bone breakdown. So you actually need that to prevent osteoporosis. And if you already have osteoporosis, all the more that you need it. No, there are also another medication that can be used for to manage osteoporosis, no, in the setting of hormone therapy, breast cancer hormone therapy, which is denosumab. Okay, denosumab, the main difference between denosumab and zoledronic acid, it's a weekly injection. Denosumab it's also an injection, but administered only once every 6 months.
Okay.
Okay? So for those of you who are quite afraid of needles, then denosumab might be another option that you can consider. Okay?
Yeah, that's very helpful, Doc. Thank you, thank you. All right, another question coming from Miss Georgina Mercedes Francisco. For patients with allergy to statins, what do you recommend and how often do you check for cholesterol levels when one starts medications?
Yeah, for if you have allergy to statins, no, then obviously you cannot take statins anymore. Another substitute for that would be fenofibrates. Okay, and the good thing about fenofibrates, by the way, no, fenofibrates is mainly used to lower triglyceride levels. So that's where it is more commonly used for. Okay, so you can use that instead. The good thing about it is that fenofibrates is actually also a PPAR agonist. Okay.
Oh.
Yes, so that specifically attaches to the PPAR alpha. Okay. Anyway, that's to medical already, but that's also one, no? But if if your triglycerides is normal in the first place, no, it's only the cholesterol that is high. Another method would be to, eat a high fiber, low fat diet. Okay, that would be the best. And you can actually even supplement with Simply Nature PPARs. That's actually also one of the supplements that I usually prescribe to patients who have high blood cholesterol and high blood triglyceride levels. Okay, so those are your options. But the best method would still be, change your diet.
Thank you, Doc. I'm just very curious, Doc, now. Is there a type of breast cancer wherein cisplatin and oxaliplatin are being recommended to as chemo drugs?
Not so much, no. Pero if ever they are recommended, it would be triple negative breast cancer. Usually, it's triple negative breast cancer when chemotherapy is usually prescribed.
I see. I'm just very it's joyful to know because our PPARS has clinical studies that can, of course, with this medications. Thank you, Doc. Right. Another question coming from Ms. Shani Tolentino: is invasive breast cancer curable by means of herbal medicine?
Excuse me.
It's okay, Doc. Water.
Water. I inhaled my saliva.
It's okay. By the way, guys, of course, for those of you who wish to have a consult with Doc Jansen Kalalam, please do type in how to consult. Miss Beth from SMG will definitely get in touch with you individually, or you can just click the link on the description box where you can schedule an appointment with Doc Jansen. Are you ready, Doc?
Hey, going back.
I
Okay.
think Sir Sean remembered you.
Yes, someone. Anyway, if you rely on herbal meds alone, no, you won't be able to cure invasive breast cancer with herbal meds alone. Okay? For any type of cancer for that matter, it's always in your best interest if you will utilize all modalities that would be applicable for you. So if you are recommended to undergo chemotherapy, definitely chemo. If radiation therapy is applicable for you, then undergo. Of course, with these conventional treatments, it's always important that you change your lifestyle. Okay, because by changing your lifestyle, especially your diet, you not only are able to address the progression or the worsening of the cancer. Once you are in remission already, you will also be able to prevent the recurrence and prolong your overall survival. Or in other words, the amount of the remaining life you have. Okay, that's overall survival after getting diagnosed with cancer. Okay, yeah. So
Thank,
there you have it.
thank you, Doc. I know this is just one of the things that I've learned from you and Sir Sean, to really look beyond the treatment, right? And to look beyond the survivorship as well, prevent recurrence. Okay, another question coming from Miss Prima Bakay. What is the side effect if you are taking medicine for high blood and cholesterol for a long time?
There's none. But as long as you maintain on the proper dose. Okay? Because, for example, long-term effects of hypertensive meds and what's the other one?
The high blood and
Cholesterol,
cholesterol.
yeah, medication for
Yes.
cholesterol, no. Long-term, no notable side effects naman. It's just that if you are taking too low of a dose, your blood parameters are still not controlled, then you have to increase the dose. If you are taking too much, you are already experiencing very low blood pressure, then you have to taper down the dose, no? So it has to be well balanced. Okay? But the medications per se, long-term use, are there any side effects? Not really. Those two medications can actually prevent complications like heart disease, specifically heart disease. Okay, and and to prevent heart attack as well, stroke as well, and CKD. Okay, so take your medications. Don't stop them unless your doctor tells you to.
Thank you, Doc. It's good thing that you've mentioned that, because we have some patients before who started taking PPARs alongside their medication. And then this is why you mentioned you really have to monitor your blood cholesterol levels, your sugar levels, because it might be corrected and you really have to taper off or adjust your medications.
Yes.
Thank you, Doc. Okay, another question thrown in on the comment section coming from Miss Amelia Rivera. If I want to talk with Doc Jansen, how much po is their professional fee? Is it free to ask question? Yes, you can definitely ask question, and you can definitely schedule an appointment with Doc Jansen.
Yeah,
Yes,
you
Doc.
can you can ask your question now over here. This is definitely a free a free interaction. But
Yeah.
if you need more help, okay, you have to set an appointment already. Okay, and of course there would be a consultation fee for that. Okay, yeah,
Get in touch with us.
just message Beth so you can learn more details.
Yes, sir. Don't worry, Doc. She already thrown in her question. Okay, because the question is, as you said, Doc, if a patient has high level cholesterol tendency, if a patient has a high level cholesterol tendency is to increase recurrence of breast cancer, if that is the case po, any suggestion to avoid such?
Yes, here's the thing, no. If you have high blood cholesterol level, um, you are definitely eating foods that can increase your risk for cancer. Okay? Now, high blood cholesterol per se will not cause breast cancer. Okay? For example, you have a genetic problem which is called familial hypercholesterolemia. So meaning, this is a genetic problem among people wherein they have abnormally high amounts of cholesterol. However, they are not eating foods, or their lifestyle is really good. They're not eating foods that can contribute to breast cancer. Then they won't be able to get an elevated, or they won't be able to get the risk that's coming from the foods that shouldn't be eaten. Okay, I hope you understand me, no? However, if you don't have this kind of condition, okay, your blood cholesterol is so high because of the food that you're eating, then definitely there is an elevated risk. Okay, but this is mainly because of the food that you're eating. Okay? It's mainly because of your lifestyle. Okay, so I'll give you an example. What would be foods that would cause, or that would increase your risk of breast cancer? That would be red meat, processed meat. Okay, what else? Yeah, let's just talk about those two.
So those two are very high in cholesterol, correct? And definitely, they can cause cancer. So if you eat them, what will happen? You will have high blood cholesterol level. Also, you will have an elevated risk of breast cancer as well. Okay, so I hope you get me, no? So cholesterol per se will not cause breast cancer. However, the reason why you have high blood cholesterol is because of your lifestyle, and the lifestyle is the one that increases your risk of breast cancer. Okay.
Thank you. That means by improving your diet and being on a plant-based diet, it's like targeting two birds in one stone, right? Resolving your high cholesterol and also resolving the cancer.
Yes. And also, no, for that matter, if you're already diagnosed with breast cancer, then that's a different thing. Since you already are diagnosed with breast cancer, then having high blood cholesterol level, the cholesterol can feed the breast cancer. Okay, so it's very important for cancer patients, especially breast cancer patients, that you have normal levels of blood cholesterol. Okay, ideal optimal level would be 150, less than 150. Okay.
I just remembered my BB yesterday, but it was corrected. Don't worry. It was just because I walk a long distance. Okay, thank you, Doc. Okay, for our next question, okay, this is coming from Mr. Bert Batak. Doc, does Simply Nature have all the alpha, beta, and gamma isoforms? It's just my doctor is asking.
Yes, yes. They are present. All are present. Okay. What's wonderful about it is that if all are present, then you will have all the effects of stimulating the PPAR agonist. Now, if you will read further, you will see some negative effects of PPAR, PPAR gamma. No, PPAR delta. Okay. Now, if we take a look at PPAR delta alone, you will see negative effects, no? However, the effect of PPAR delta is counteracted by the effects of alpha and gamma. Okay, so you don't worry, okay? Because all of these reasons, Simply Nature PPARs, it's made from microalgae, so it's a whole food, no? Since it's a whole food, the effects would go beyond the ones that are listed on the literature. Okay, the effects would go beyond that. So the negative side effects that you see in with PPAR delta, don't worry about those because those will be counteracted by the effects of the gamma and the alpha. Okay, I'm going too technical, but I hope I answered the viewer's question.
Thank you. I've talked to this person. It's very important that the answer is really coming from you, Doc. So yes, there you go. They are all present. Thank you. Okay, another question coming from okay, Miss Amelia. Is Ensure or can Ensure increase high level cholesterol?
Yes, because it's high fat. Okay, it's high fat, no? So if you consume very high fat foods, high fat meals, okay, the way our body metabolizes this is to produce cholesterol. Okay, the main role of the cholesterol is to transport the fat from the intestine towards your body, inside the body. So inside the body, you will now transport the fats to different parts. Okay, you need cholesterol for that because cholesterol is a transporter. Okay, so the two main transporters would be your LDL and HDL, the good and bad cholesterol. Okay, so the LDL is the one that transport fat towards your peripheral tissues, to your blood vessels. Okay, HDL is the cholesterol that transports fat away from the blood vessels. That's why it's good cholesterol. Okay, so those are so cholesterol is just a transporter. Now, where is cholesterol made? It's made from your liver. Okay, we make our own cholesterol, so we do not need to supply them from dietary sources. Okay, now if you eat high fat foods, again, the body will need to transport that, and in order to transport the high amounts of fat that you just ate, your your liver will produce very high amounts of cholesterol to transport that. Okay, so that's why plant or dairy products are very high in fats. Even the low fat ones, they are labeled low fat, right? That's still high in fats. Okay, so don't believe. Or the non-fat still has fats. Okay, so
And of course, Doc, your best recommendation as an alternative to ensure.
Yeah, alternative for Ensure would be plant-based Ensure. So it's still Ensure, but it's just plant-based. But nevertheless, it still has saturated fats. So if I were you, I'll just go for the plant-based milks like soy milk, almond milk, oat milk. Yeah.
Thank you. Doc, can you just like very, very quickly reiterate how, because this is a myth amongst our breast cancer patients, wherein soy milk, they said it's not good for them, or soya, any soya product. What can you say about this?
It's not true. It has been debunked already many times, many times over. Okay, so it's not true. Soy milk is actually even recommended by the American Society for Clinical Oncology. So if the Americans, I mean, if ASCO recommends it, why wouldn't you take it? I mean, drink it, right? Okay, so aside from these medical societies recommending, no, what is the study? What is the evidence behind this? So, on population levels, those populations that have very high soy food consumptions also have very low breast cancer rates. Okay, and for those people who have breast cancer already, compared to for breast cancer patients, okay, those who are consuming soy versus those who do not consume soy, those who consume soy products have better overall survival, have lower recurrence rates, they have better outcomes when it comes to chemotherapy. They also have less side effects with chemotherapy compared to those who are not drinking soy milk. Okay. Now, what's the mechanism behind this event? Okay. Reason being for breast cancer cells, no, breast cancer cells kasi have estrogen receptors, and our body produces estrogen. Okay, now if our body produces estrogen, when the estrogen attaches to the breast cancer cell, the breast cancer cell can grow. That is the rationale behind the soy, no? And soy has been found out that it contains estrogen. It's just that it's plant estrogen. Although it's estrogen, the molecular structure is very different. It's very different than animal estrogen. Okay, so the way plant estrogen acts is that it attaches to the breast cancer cell. However, when it attaches to the breast cancer cell, it does not cause the breast cancer cell to grow. So in a way, it acts as a block against the animal estrogen that we produces or that we drink from the dairy products. Okay? So in a way, it is a modulator. It blocks the attaching of the animal estrogen to the breast cancer cell. Also, where else in our body would it be very helpful? Soy products has also been found that it can help bone growth. So if you have osteoporosis, drinking soy milk would also help. Aside from it having high amounts of calcium, it also can stimulate the estrogen receptors inside the bone so that osteoblast, the bone-forming cells, gets stimulated and it forms bones. Okay? So, yeah. If you have breast cancer, it would be in your best interest to consume soy. Okay?
It's very, very, very encouraging. Thank you, Doc. What's good about it, Doc, is, even for people who doesn't have any breast cancer there, the soy mix is actually an option as well in Starbucks, in common stores as well. So perhaps we want to start off diverting from dairy to soy milk. That's one of the best tasting plant-based milk. Thank you, Doc. Right, another question coming from Ms. Cora Alba. Can we take PPARS tablets and also cleansing plus even without cancer, but with high cholesterol to reduce cholesterol and immunity? I'm taking statins too.
Yes, of course you can. No, however, don't take them together. Okay, there is a specific.
Go ahead.
Okay. Now, to tell you, I cannot tell you outright what the scheduling would be because I need to know what medications you're taking. Okay, so I suggest if you really want to know, go for a consult. Okay, but definitely in terms of trying to lower your cholesterol level, aside from taking statins, yes, Simply Nature PPARS can, Cleansing Plus also can. Okay, so Cleansing Plus is a fiber supplement, and the way this works is that since it's fiber, it will act like a sponge, no, for your bile acids, no. The bile acids is actually a derivative of cholesterol. Through the bile acids, that is actually how we are able to eliminate cholesterol from our body. Okay, because we poo that out. Excess bile acids gets pooed out. The rest just gets reabsorbed through the system. Okay. So yeah. If you have a very high fiber diet, then gastric motility would be very fast, relatively faster. Okay, so we will be able to poop out the unnecessary toxins, excess cholesterol through your stool. Okay, you won't be able to reabsorb them anymore. Okay, so that's how Cleansing Plus can help you lower your cholesterol. Okay.
No wonder you kind of always include this in the protocol for your patients.
Yes,
right?
especially for people who have high cholesterol levels, no? Cleansing Plus is as a mainstay. And this is also for you, people who are very, who have difficulties in transitioning, no? Because, transitioning from the diet from your favorite diet, no, to plant-based diet can be quite challenging. So during the transition period, fiber supplements would definitely help you to get the benefit immediately, because some patients we need to get immediate effects already, so we cannot wait. So we have to stimulate, we have to catalyze or enhance the effect or make the effect faster, get the effect faster. Okay.
It's true, Doc. And weekend tomorrow. It's Friday tomorrow, and I'm sure everybody will get a very good weekend, eating as much as they can, right? Because they will enjoy that. So I suggest you keep a Cleansing Plus sachet in your bag always. Thank you, Doc. Okay, another question coming from Miss Maria Chami. Hi, can I ask about this? I am a 10-year survivor, and now I am diagnosed with osteoporosis and rheumatoid. Doc prescribed me a Posevans once a week instead of injection. I think the question is this okay?
Posevans, let me see, because that is a brand name. Posevans is, let me see. Yes, this is alendronate. So this is very similar to zoledronic acid. No? Posevans has alendronate and vitamin D. Yes, continue that. You need that, okay? But more than this, in order to form bones, you need to exercise, okay? Because if you don't exercise, you're just taking this, then it would be very difficult for your body to form bones, okay? So very important that you maintain physical activity, like exercises would do. Just walk, no? Yeah, that would be fine. But if you can do resistance exercises, okay?
And soy milk, so that you can have a lot of calcium.
Yep.
Okay, thank you, Doc. Right, another question coming from from Miss Rhea. I was diagnosed with subglottic stenosis, SP tracheostomy 1993. I have hoarseness of voice, husky voice for several years. I am now 32 years old with 3 kids and have uncontrolled asthma too. Can PPARs help, and is this okay for breastfeeding?
Yes. Breastfeeding, you can definitely breastfeeding. Taking PPARs is okay for breastfeeding, no? And for that matter, Simply Nature PPARs can actually even help your asthma. But however, the hoarseness of voice, you need the speech therapist for that. I just know a very good speech therapist from UP. Okay, she's a professor from UP. So if you want, I can make the referral. Okay, so if you can, for me to give you the proper dosing, no, for the proper dose of PPAR agonist for your asthma, please set an appointment so I can help you more. Okay.
Plus, this PPARs is also good for your kids, right?
Definitely.
She has kids. Okay, thank you, Doc. Okay, another question coming from Ms. Cora Alva. Can hypothyroid increase cholesterol level? How
Yes.
about...
Yes, hypothyroid and cholesterol, yes. What's the second question?
Okay, next question. How about euthyroxine meds? can it increase cholesterol and have can have heart disease, or maybe it can
Oh,
incur heart disease?
yeah. Euthyroxine, no, it won't. Thyroid hormones main use is for the metabolism. If you have low thyroid hormones, then that is the time that your cholesterol level, your triglycerides can increase. Okay, because your metabolism is low. Okay, your body's capability to break down these molecules is hampered, or is lower. Okay, so definitely for hypothyroidism, you need to take your levothyroxine medication. Okay, however, don't just stop there. Okay, because even if you are taking your thyroid hormone medication, if your diet is not good, even if you take so much thyroid medications, your blood vessels can still get plugged. Okay, because of excess cholesterol level. So definitely make sure that you are still eating a very good diet, or a very healthy diet. Okay.
Yeah. So this plant-based whole food diet is not entirely or specifically only for cancer patients. So it's all for everybody, even for those healthy people. Okay. Thank you, Doc. Okay. Another question coming from Miss Marvic de Gala. Doc, how about Anlin? Is this recommended?
No. Anlin usually is given or marketed for pregnant women, and for osteoporosis.
Elders, also for
Elderly,
elders.
yeah, mostly for elders, no. No, dairy products cannot prevent osteoporosis. In fact, when you look at countries where dairy consumption is very high, you can also see very high rates of osteoporosis. So if really dairy can prevent osteoporosis, why is this happening? Okay. Contrary to this, no. Um, in countries where dairy consumption is not mainstream, okay, like Asian countries, this is also where you see very low rates of osteoporosis. So dairy is not okay. It's not okay. Yeah.
I remember Sir Shyan mentioned in our previous webinars wherein most Asians are actually lactose intolerant. That's
Yeah.
why you're kind of safe.
Yeah.
There you go. Thank you, Doc. Okay. Okay. Another question coming from our YouTube, one of our videos there. Doc, my or can I just in Tagalog, nabangga po ang suso ko sa doorknob, may nakapa akong buko. So she was able to feel a lump on her breast because she bumped it on the doorknob, coming from Miss Rose.
Okay, three things. Three things. Traumatic injury to the breast will not cause tumors to occur. Okay, it will not. So what did you feel? Number two, that might be something that's already there for a very long time. It's just that your breast got bumped, then you're able to you palpated, or you tried to feel your breast, then that's the time that you felt it. Okay. Number three, the trauma, the doorknob actually caused a localized swelling. You felt last like a lump. Okay. So if I were you, I'd get myself checked. Okay. Wait for probably a month, then get breast ultrasound with mammogram, because we don't really know. No, it might be something that was already there for a very long period of time already, and that was the only time that you were able to feel it. That's why. Okay. However, breast trauma, okay, no matter how much injury you inflict on it, or physical injury you inflict on it, okay, that will not cause lumps. Okay, that will not cause cancer or breast masses. Okay.
It's good that we are talking about this because I'm also a lady, and I'd be also worried if I feel something after bumping my breast onto something. Okay, thank you, Doc. Okay, another question coming from Miss Mercy. Can underwires bras increase the risk of breast cancer?
No, it won't. Even if you have wires. Okay, so it won't increase the risk of breast cancer. Increasing the risk of breast cancer would still remain to be lifestyle in origin and whether or not you have a family history. So that would still be the main risk factors. Okay. Type of bra doesn't matter. Okay.
So if you're not comfortable with your bra anymore, replace it.
Yeah, just replace.
Simple as that. Yeah. Okay. I'm just very curious. How about breast implants, doc? Can it cause?
For breast implants, silicone won't. It won't increase the risk of breast cancer as well. I just don't know with other types of breast implants, especially older ones. The older ones probably yes, but the newer ones they won't.
Thank you. Thank you. Another curious question, very, very quick. How about for those ladies who are, doing tattoos or having tattoos on their breast?
What again?
Like if they wanted to have that tattoos and they have it on their breast, some ladies do that.
Tattoos.
Yeah.
Oh, that I don't know.
Oh, okay.
That is a very good question. Let me see. Let's see. Breast tattoos and breast cancer risk. Let's see.
We are in the modern world.
I'm guessing that it might take.
Yeah, because a lot, we are in a modern world. A lot of ladies are doing, a lot of fun stuff in their bodies. Maybe it's good to know if it's okay to do it or
My
proceed
guess
with
is
it.
it will. My guess is it will. However, the literature is actually divided.
I see.
Yeah. Some say that tattoos are not linked to breast cancer. However, since the inks have heavy metals, the heavy metals can be absorbed through your skin, and the heavy metals might be the one that is responsible. Okay?
Yes,
But how much can it increase your risk of developing breast cancer? That we still don't know. Yeah, but it's it's actually a very good thing to investigate.
Thank you, Doc. All right. Okay, so another question. Okay. Someone is asking about almond milk. I think, what's the comparison of it to soya milk, perhaps?
Well, one is a bean, another one is a nut.
Just the taste. But both have good
taste.
amount of calcium.
But in terms of calcium content, soy milk would definitely have higher amount of calcium. However, for omega-3 fatty acids, definitely almond milk would be higher compared to soy milk. In terms of isoflavones, would definitely be higher on soy. Almonds don't have isoflavones. I think if they have, it's very minimal. Okay. Yeah.
Thank you, Doc. Okay, another question coming from Ms. Rufina Francia. Is sugar really bad for cancer patients?
What again? Come again?
Sorry. Is sugar really bad for cancer patients?
Yes, of course. Sugar, especially refined sugar, because sugar feeds cancer. Yeah. So if you consume a lot of sugar, very low in fiber, no? Like for example, sweetened beverages like your sodas, fruit juices, what else? Iced tea, your powdered juice drinks, your energy drinks, pastries as well, no? Ice cream, these things. The sugar content of those foods would immediately be absorbed very fast towards your bloodstream. Okay, you'll have blood sugar spikes. Okay, and the excess blood sugar would definitely feed your cancer cells. So cancer cells would be happy. Yeah. So very important for you to control your sugar intake. Okay. If you have a sweet tooth and if you have cancer, get your sweets from fruits. Okay, because fruits will be safer. Okay.
Thank you. Let me share what I've learned from Doc Jansen. What would be the best alternative? You mentioned Doc Jansen before. It's date sugar and also blackstrap molasses.
Yes, that would be two sweeteners that still retains their antioxidant content. Yeah, so that would be the lesser evil.
Thank you, Doc. A lot of our viewers are asking, like Miss Deli River and also Miss Amelia, how to get in touch with you or how to make an appointment with you. Of course, guys, for those of you who wish to have a consult with Doc Jansen, please, you may just type down how to consult or simply click the link on the description box where you can schedule a consult with Doc Jansen.
So,
Lisbeth will get in. Yes, Doc.
have a number of ways, no? So that's one. You can also message us in our Facebook page, Simply Healed Medical Group.
Yes.
We can also go directly to our website, simplyhealedmed.com. Or you can email us at wecare@simplyhealedmed.com. Okay,
Yes.
so one of those ways. Just Google us, will appear there. Okay, just look for Simply Healed.
I've seen how Doc does his consults. He's very meticulous. He digs deeper on your medication so that he can actually recommend the best protocol for you. Thank you, Doc Jansen. Okay, another question coming from what's this? Okay, coming from Mr. Edward. What do you suggest for a breast cancer patient with stage 4 with fungating wound? Fungating wound.
Yeah, that's bad.
I think pressure.
What would I recommend? I suggest for you to undergo hyperbaric oxygen therapy.
Oh.
Okay, you can go and see me at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center. Okay, just set an appointment there. You can just walk in. My schedule there is every Wednesday and Friday. Okay, I'm there the whole day. So just go there. Then we can talk about your case on how we can address that non-healing wound. Okay, because that can be a source of infection. And hyperbaric oxygen can actually help you reduce or help heal that wound. Okay.
I see. Thank you, Doc. Another question. How about Doc Buamera mix? Is it good to take?
Depends on what for. For Buamera mix is just an herbal mix, no. However, again, don't just rely on that. But Buamera per se, I don't think it has any detrimental side effects. So it's okay if you want to take this. But to claim any health benefits, therapeutic claims for health, not really. Especially if this is in juice form. Usually it's in juice form, no. A lot of herbal supplements. If it's in juice form, I don't like it because the sugar is too high. No matter the claim, no matter what kind of claim they have, okay, no matter how many antioxidants they have, if the sugar content is very high, it's not gonna work.
I think it's a common ground now, Doc, with a lot of supplements now, most especially the juice ones. They taste really good.
Yes,
Yeah.
I've heard this once or twice actually, Buamera. But again, if the sugar content is very high, especially if it has sucrose, fructose, high fructose corn syrup, the antioxidants will just counteract the effects of the inflammatory effects of the sugar. So it's useless actually.
Very informative. Thank you. Okay, another question. Doc, coming from Miss Angel. If the egg yolk is high in cholesterol, is egg white allowed? Good
No,
question.
because egg white will promote the clogging of the arteries. Okay? Egg white, that is very rich in choline. Okay, yung egg white. Now, when egg white mixes with when that egg white goes to your stomach, no, goes to your intestine, and is metabolized by the gut microbiome, the gut bacteria produces a substance called TMA, trimethylamine. So this trimethylamine will be processed by your liver. So once it gets processed by your liver, that will turn into trimethylamine oxide, TMAO. So TMAO, this substance, promotes atherosclerosis. It promotes clogging of the arteries. So you're still not safe with egg white. Okay? So eggs, for that matter, the whole thing, every part of it is not good for the body. The limit is half an egg every day. That's it. And once you eat half an egg a day, cannot eat any high cholesterol foods anymore because you'll go overboard already. You're gonna go beyond your limits. Okay, so
Doc,
there you
please
have it.
don't laugh at me with my question, because eggs are quite big. How about for quail eggs? Like if I just eat two of it, I just want
It's the same thing.
small.
It's the same thing. No?
Mm.
Well, quail eggs naman, egg yolk still has a very high cholesterol level, and it has egg white, so the egg white would still produce the same amount of effect. And how do we eat quail eggs? It's through frying, right? You boil the quail egg, tapos dun sa, yung matuturo, atok naming, and
Yeah, quick, quick.
quick, oh yun. So those are fried, right? So yeah, that would further add to the amount of oil and cholesterol that you eat. Okay, so better to avoid, especially for cancer patients, no, and patients who have heart disease and who have had stroke. Okay, best to avoid that.
Double kill siya.
Yes.
Parang ganun. Thank you. Thank you, Doc. Okay, another question. Okay. We have quite some few questions pa. I hope we can answer everything, Doc. Hi. Okay. All right. Another question coming from Miss Deli. How about fruits? Others said that they are bad for cancer since it has fructose.
Okay. Fruits, of course, it's sweet, no? The sweetest comes from fructose. However, here's the thing. The difference between fruits and your sweets is fiber and antioxidants. Fruits are very rich in antioxidants, very rich in phytonutrients, very rich in fiber. That is not present in your sweeteners or your in your sweetened your pastries and these
Yes.
or your refined carbohydrates. Okay, so that's why fruits is okay. In fact, fruits can lower your risk of cancer. Okay, eating fruits. Okay, compared to those who have high fruit consumption versus those who have low fruit consumption. Those who have high fruit consumption have lower risks of cancer, not just breast cancer, all other types of cancer, including including your prostate cancer, your colorectal cancer, your lung cancer. Okay, so eat fruits. If you are already diagnosed with cancer, continue eating fruits because you can get antioxidants, anti-cancer nutrients from there. Okay, so why would you not eat fruits even if you have cancer? Okay, because the sugar from there you won't absorb them very easily anyway because it has fiber. And of course, when you eat fruits, eat them together with your other foods. Okay, eat it together with your vegetables. Okay, so that's the way. Okay, so continue eating fruits. Huh? So I'll just give you some bonus here. No, fruits that have good anti-cancer properties would be your lemon, but include the zest. Okay, apple, include the skin. Okay, grapes, your berries, cranberries, raspberries, blueberries. These fruits, no, are all very good for cancer. So eat fruits. Okay. I think, Sheila, you're muted.
Sorry. Okay, one more time.
Okay.
Thank you. Okay, thank you, Doc. And with what you said, I think it's better to use blender rather than juicer, right?
Yes, blender would be better than juicer because
Oh.
if you blend it, the fiber is still there. Okay, if you juice it, you remove the fiber, you only drink the liquid. Okay, so that's all sugar. So don't juice. So fruit juicing or juicing can actually harm you if you have cancer. Okay, go for smoothies. And for that matter, if it is in smoothie form, drink it slowly. Okay, because drinking
Yes.
very fast will that will also you'll also absorb the sugar too fast. Okay, we do not want that. So drink it slowly. Enjoy it. Enjoy it.
Yes. The same period of time that you'll be eating the whole fruit, not blenderized. I see. Thank you, Doc. Okay, Doc, I just want to ensure that the link is that the link for them to book a consult for you is working. I hope everybody can try to click the link on the comment section. Right? And can you please type in if it's working or like just type in yes, it's working. or no, it's not working. All right, because if it's not, then and if you really want to have a consult with Doc Jansen, then just type in how to consult. It's the link is not working at the moment. Okay, thank you, everybody. All right, so few questions more. Okay, Doc. The question is, what is the possible best nutritional drink for best breast cancer patient? I think you've mentioned.
Best nutritional drink.
Yeah.
It would be smoothies. Smoothies. Definitely smoothies, no? Because for smoothies, everything is there. Okay? So if you're going to make a smoothie, no, always include fruits, vegetables, beans, nuts, seeds, and your whole grain. Okay? The best example for this would be the breakfast smoothie of Go Salads.
Oh.
Okay? So just try to Google that, no? Go Salads breakfast smoothie. That is how you should be making your smoothies. Okay? By the way, I'm not sponsored by Go Salad, okay?
Yes,
But
that's
if
about
the
to
owner of
say.
Go Salad sees this,
Baka naman like that.
okay? So, yeah, that's how you should be making your smoothies, no? So always include fruits, vegetables. Vegetables would be your greens, obviously. Okay, so greens can be, di ba? Talbos ng kamote, pwede rin kale if kale is even
Yeah, available.
quality. What else? For fruits, whatever fruit, no, you can include there apple, grapes, strawberry, whatever. For your legumes, beans, nuts, and seeds, seeds definitely flax seeds, ground flax seeds. That is the best seed for breast cancer. What else? Soy milk, use soy milk as base. Yeah. Then for your whole grains, that would only be oatmeal. Okay.
I see.
I haven't seen any guy who used rice for his smoothie.
You
No,
can't imagine.
tastes like so. You just use oatmeal. Okay. So yeah, that's it. That's it. Aside from smoothies, what else? What kind of beverage that would be tea? You can choose between two. You can choose between green tea or matcha and turmeric tea. But however, the turmeric tea has to include ground pepper, because if the turmeric tea doesn't have ground pepper, you won't be able to absorb the curcumin. That won't go to your breast. You'll just poo it out. So include ground pepper. But for that matter, the taste I think is weird. Adding ground pepper to turmeric. So if you want the turmeric benefit, then just eat yung royal. Lagay mo sa ulam, tapos mix it ground pepper, or just eat curry. Oh, that's it.
Ay, naku, ang sarap, diba? There we go. Thank you, Doc. Okay, another question, just reiteration, because you've mentioned this a while ago from Miss Mavs Agot. She's asking about plant-based Ensure milk. Is it okay?
Yes. Plant-based Ensure would be my other alternative especially for very frail breast cancer patients, especially if you are already very thin. We would need to increase the amount of calories that you're consuming. So plant-based Ensure would be okay. Yeah.
Like the last resort. Thank you. Thank you, Doc. Another question comes from Miss Nelia, the Iro. I had partial mastectomy due to DCIS stage 0. Is it okay for me to eat dark chocolates?
Yeah, it's okay. I mean, yeah. Just make sure the dark chocolate doesn't have casein and whey. Okay, so make sure because there are certain dark chocolates that includes these ingredients. Okay, don't. Okay, since you underwent surgery already and the breast cancer stage is 0, so that is very early stage detection. No, yeah, eating dark chocolate is fine.
0. Wow, thank you, Lord. Okay, thank you, Doc. Okay, another question coming from Miss Amy. I'll just read it, Doc. Good evening, Doc. Ask ko po, meron kasi si mother ko na-detect po siya noong February this year. Sabi ng doctor, spread out na po yung cancer niya sa bones. Sa bones niya, sa likod. Dahil may lumbar po siya, fracture scoliosis. Ngayon po, lumalaki yung tiyan niya at bumibigat. Hirap din siya mag-bowel movement. Bali, bigla siyang naging bedridden. Ask ko po bakit parang palagi siyang inaantok.
Bakit palaging inaantok? A number of reasons. Number one reason might be liver failure. Another one would be probably she already has brain metastasis. Another one would be kidney. Kidneys are affected already. So one of those, would there be any other reasons bakit inaantok siya palagi? Mm, I can't think of any other actually.
Okay, perhaps to be really sure, no, you might want to go for a consult with Doc Jansen.
Yeah, I think it would be better if I can talk to you, set an appointment, no. But well, another one would be your pain meds because certain pain meds can make the patient groggy. So that's one. Also because of the pain, no, that can also make the patient weaker. That's why parang medyo inaantok siya because of the pain, because of too much pain, nagbanhid na, the brain is trying to shut down to lessen the pain. So that, but ano na to, I'm just thinking from my mind, one of the possible reasons, no. Pero less probable eh. What I'm thinking is baka mamaya may mga ibang organs na affected which is causing the decrease in consciousness or decrease in sense motor. Okay, so yeah, better go see your doctors, no, about this to find out why para ma-address din. Okay?
Yes. This is why here in Simply Nature, no, we really want our patients as well to coordinate, always coordinate with your doctors for them to see your improvement, to see your status. There you go. Thank you, Doc. Okay, I think this will be our last question coming from Miss Deli River. How about ozone therapy, Doc? Okay.
For what? For what? Yeah.
Let's say for cancer, though, for cancer patients.
Yes, no, for cancer. However, please please be careful, no. It is not a substitute for chemotherapy, okay? It is not. It is not. Okay. Ozone therapy will just allow your body to heal faster. Okay. I won't explain the technical stuff already on how it does it, but the main benefit that you can get from it is that your body will heal. Okay, it stimulates healing of the body. So if you have cancer, it's not enough to stimulate healing. You have to kill the cancer. Okay, ozone therapy. I'm not that confident that it can. However, can we give chemotherapy together with ozone? Definitely, yes. Because with chemotherapy, of course, your healthy cells would be killed off, right? So you can undergo ozone therapy to help you recover faster. And there are other modalities, no, where we can help you for chemotherapy support. Yeah.
That's good. I think, a lot of our patients here are really researching a lot of, things that could help them along their treatment. So that's good.
Yeah, itong ozone therapy kasi, this was developed in Germany. Okay, that was a German inventor was actually that is where it came from. It is widely used there actually. Yeah, and here in the Philippines, I think ozone therapy is already here in the Philippines, but it is still not that widely utilized. But there's good evidence that it can really help people, especially patients who have non-healing wounds. Okay. Yeah. Doon siya pinaka-effective, no? So diabetic foot, cancer, yung yung non-healing wounds of tumors, especially on the breast. Sometimes the breast kasi the tumor is already very advanced. Sometimes may nana na, there is pus already coming up. So these modalities can definitely help you. Kasi aside from that, what are we left with? Antibiotics and antibiotic cream and then just clean the wound. And that's it. So there's no other, it's not enough, definitely. Those two will not cure the wound, right? Somehow we need to stimulate the healing. So that is where those other modalities can come into, like your hyperbaric oxygen, your ozone therapy, these things.
You have a lot of options. Yes. Thank you, Doc. Okay, Doc, I hope it's okay. There's our two new
Yeah,
questions.
sure, sure.
Okay, coming from Miss Leslie Doran, Doc, pag BIRAD 2, yung cyst sa breast ultrasound, may possibility ba maging cancer? Hindi palpable yung cyst, ano ba, wait. Hindi palpable yung cyst, pero lumaki compared dun sa previous breast ultrasound.
Yeah. Yes, no. So we have what we call malignant transformation. Okay. So cyst, although yes, a breast cyst is benign, that is BIRADS 2. You don't actually have to worry about have to worry about it, no. Andyan lang talaga yan. Sometimes it increases in size, doesn't necessarily mean that it is cancer.
Mm-hmm.
So if I were you, I'd continue to monitor.
Mm-hmm.
Okay? If it increases in size, if it's very painful, then you can have it removed. If not, dyan lang siya, it just increases in size, then just continue monitoring. And then what you need to do is to make the necessary lifestyle changes so that you prevent breast cancer. Okay? Yun.
Start off na with healthy diet.
Ganun yun. So, ano yan kagad? Plant-based diet, physical activity, dapat regular physical activity, good quality sleep, these things. Okay?
Yeah, very, very encouraging. Thank you, Doc. Okay, another question, quickly, coming from Ms. Lloydan, yes. Ludik po, which of the two milk would you recommend for an ER/PR positive breast cancer? Soya milk or almond milk?
For me, soy milk.
Soya milk, I see.
Milk pa din, yes. Why soy milk? Because the evidence behind yung population studies that I just told you a while ago, those were done on hormone positive breast cancer patients, ER/PR positive. So evidence, we base our claims on evidence. So that's what I will recommend you. Ano pa rin, soy milk pa din.
Thank you. Thank you. Doc, don't worry, Miss Lloyda, if you are kind of late in joining our webinar, you can do a replay, all right? Our webinars here in Simply Nature are actually replayable, so you can share it with your friends and co-patients in your hospitals. Okay? Okay, last question, Doc. Coming from Miss Lillian Shoko. Doc, I was diagnosed breast cancer stage 1 and had my mastectomy. I had mama print test done. How accurate is this test?
That's one of the best tests that you can undergo. Mama print is actually good. It's actually good to determine which treatment modalities would give you the best outcome. So it's good that you underwent one. I think ang balita ko with mama print, it's quite expensive as well to do. Yeah. So yeah, it's good. Yes. So whatever it says, give that to your onco. Have your onco read it so that you can, both of you, can agree on a treatment plan. Okay?
Ma'am, humabol si Miss Jim Apol. How about oat milk, Doc?
Oat milk, not so much eh. Okay, so between those three milks, ganito okay. Between those three milks, ganito yan. So you have your soy milk, which is a bean. You have your almond milk, which is a nut. You have your oat milk, which is a whole grain. Okay, so which among those three will you choose? It depends on what you just lacked with your diet. Depends on what your meal is, no? So if you find out that your meal is centered around more on vegetables, you have your nuts already, you have your tofu, okay, then why not go for the oat milk? Diba? Para kompleto. Because for this, remember, your diet should center around fruits, vegetables, whole grains, and legumes. Legumes would be your beans, nuts, and seeds. Soy milk and almond is here sa legumes, no? So oat milk would be your part of your whole grain. So now, if you already ate fruits, vegetables, tsaka legumes, meron na, go for the oat milk. If you already have whole grains, di ba? Edi go for the legumes kasi you already have whole grains eh. Okay, so just be careful, no, because oats don't have that effect. It's not that effective against cancer. Ang oat milk, ang oats, okay? It's just good to lower cholesterol, improve your blood sugar control. But against cancer per se, hindi ganun ka-effective. Okay, so I would still rely on either almond milk or soy milk. Because those, especially almond milk, no, almond kasi is one of the nuts that is really good for cancer. Apat yan eh. Walnuts, almond, pecans, and peanuts. Okay?
Handful of
Apat na yan. So, yeah, it really depends though, on what you just eat or what is present in your meal. No? So, ako, I will not just drink one type of milk always. I would mix it once in a while so that I get all four. Okay?
That's very good tip.
Or
Thank you,
your dietary
Doc.
pattern is more important than just relying on a single food. Okay? Yun ang mas important, dietary pattern. Okay?
Very good tip yan, Doc. Thank you. I myself learned from that. Thank you, thank you. Okay. All right, Doc, of course, before we say goodbye to our viewers, and of course, also before I invite them to our next week's webinar, could you please give them your very quick parting words? Our viewers tonight, of course, Doc, are combinations of patients, caregivers, and medical practitioners as well.
So I just want to thank everyone who attended this webinar. So I hope you continue to attend every week. No? So next week, we're going to have another episode. I think the episode next week would be about rheumatoid arthritis. So this is
Correct,
another
yes.
new topic, no? Because
Yes.
we don't get to autoimmune diseases or arthritis. Okay, this is one of the rare moments. So if you know someone who has rheumatoid arthritis or have arthritis for that matter, tell them to watch. Okay, I'm sure each and every single who has arthritis one way or another. No, so invite them. It's again free. Okay, and I just want to thank everybody again for asking those questions. No, because if you did not ask those questions, all the other people wouldn't have learned. Okay, so continue asking them because through asking that is how we learn. Okay, I am also learning from you. Okay, so yeah, thank you everyone and good night.
Thank you. Thank you, Doc Jansen. Of course, on behalf of our viewers tonight, thank you so much for answering our questions once again and for next week's to come. Okay. All right. So, once again, I just want to invite everybody to this coming next Thursday, that's July. Also at 7:30, our topic is entitled Remove the Pain of Rheumatoid Arthritis, 5 Steps to Control the Pain. It's very interesting. And yes, this is, we normally, or we usually have cancer webinars or metabolic issues webinars, but this one kind of rare, so I really share it with your friends, perhaps to your lolos, your parents.
Yes.
Right.
Take this chance up kasi it's very rare that we get to have this kind of topic. I don't know when we're gonna have another arthritis
Yes.
topic again. Probably next year na. So take advantage, okay? Invite them over and have them watch. Okay?
I highly suggest you ask Doc Jansen about what's the best food to take, right? for this condition.
This would
Thank you,
be your
thank you,
chance to
Doc.
ask me for free.
Exactly. All right. So once again, guys, if you wish to have a consult with Doc Jansen Kalalan, visit their Facebook page, Simply Health Medical Group. Also, like and follow both this SMG and also Simply Nature, so you can always be updated with our online events, like our webinars and other events. Okay, thank you. And I really hope, thank you so much once again for joining us tonight. I really hope to see you all once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.